Hi, everyone. I'm Dr. Lynn Wagner, and you are listening to Doc's Thoughts. So today I have very special guests. They are two women who have business within my office, and it's called Genesis by Janelle. So this is Janelle Klubertanz, and this is Mindy Boucher. So we're going to talk a lot about what they do, but the reason I wanted to bring them into this episode is because we want to talk about beauty from the inside out and how at Wagner Integrative Health, we have beauty services here, but we also have all of the inside out wellness services here. So we want to talk about how that works. And if you're someone who's interested in being your optimized person, your optimized human, how you can do that from the inside out, including some topical things that I have loved and I have shared openly with my audience. So we'll talk about all those things. The reason I also want to do this podcast is recently I was in Sephora and I'm walking around with my daughters. And I love Sephora. I'm not knocking Sephora at all. And I'm looking at all these people and they're buying like
hundreds
of dollars worth of products.
Yes.
And I'm looking at them and I'm like, I see people's level of disease, right? Because I'm a doctor. So when I see a person, unfortunately, I have a little bit of a pulse on how healthy they are. And all I could think of was you're spending all this money on your products and you're not taking care of your body. So I want to talk a little bit about that. And, these two actually do an amazing job of taking care of their physical health as well, which I think is incredible. So we're going to talk about that. And then we're going to talk about exactly which services they do and what types of things they can do for you. And we'll share a little bit about like what they've done for me. And then we'll kind of wrap it up at the end of that. So first of all, I want to have Janelle introduce herself and give us a little bit of her background. So
Okay.
I know your background, but share with the world where you came from and why you do what you do.
Okay. So my name is Janelle, as Lynn said, and my background began about 19 years ago in plastic surgery, where I found my passion for taking care of patients, making them feel confident, making them feel beautiful, and making them feel whole, if you will. Which also led me down the path of injecting cosmetic injectables such as Botox and fillers. Had some experience in dabbling in cool sculpting at that time and really just ventured into who I am today. I'm a certified plastic surgery nurse and a certified aesthetic nurse specialist, which there are a handful of these in the state of Wisconsin. So I'm proud of that. And I work hard at keeping up those certifications with 45 hours of continuing education every 3 years. And 2 years ago, I joined Allergan, which is the company that makes Botox and Juvederm. And I'm a trainer for them and get to train existing and new injectors throughout the states.
Yeah. And then you also have leadership experience. So
Yes.
In her previous job, she was the boss babe
of the aesthetic department within my old job.
Right. So it's cool because Janelle has the whole business experience, leadership experience. And, there are people popping up on every corner offering aesthetic services and injections. And it's nice to know when you have someone who's not only super experienced, but training others to do the same thing as well. So that's very cool. Okay. And then Mindy joined Janelle how long ago?
A year ago in August.
Crazy. Okay. So tell us a little bit about your background.
I've been in the medical field for about 10 years. I fell into aesthetics about 8 years ago. Very grateful for that. And then I came on with Janelle, and I feel like I've grown immensely in my injecting. There's not really.
Yeah, no. So, okay. So I'm going to talk a little bit more about like the whole inside out beauty thing. So, I wanted to define what actually is beauty. So I think beauty is from the inside out. And I think you can think of it as when you meet someone, there's people who look beautiful because they're all made up and everything's perfectly put together. And there's people who are beautiful because they have a glow and their eyes sparkle and they have an energy about them. And that's what I'm talking about. And so, in order to get that glow, there are certain things you have to do. And I know these guys do it and you're not going to glow all the time. We have our ups and downs. Let's just face it. But you have to have a healthy lifestyle. So by healthy lifestyle, I'm talking about the diet you eat, sleeping well, moving, exercising, but not too much. You see some of these people who do ultra marathons and Ironman, and I'm not saying those things are bad, but you have to be careful not to overdo it because that stresses your body. You have to have purpose and a joy in your life. So you have to have a purpose in the sense of of what you are doing in your life. You have to be able to be mindful, meaning being present in the moment and doing some sort of practice where you're not constantly scattered and all over the place. I think this rings true for all of us here.
Yes, totally.
It's always the hardest one, but it's something continually to work on. Not taking in too many toxins, so not drinking too much, not smoking. You get the pursed lip thing. So having good relationships. So that's what I talk about with lifestyle. And then you also have to have a disease-free body. Or if you have a disease, which unfortunately some of us have, and that is inevitable, you have to be managing that disease through a combination of things with lifestyle, also medications, and also, even alternative things or more of like the integrative therapies that we do at Wagner Integrative Health. So that's enough about what I think about beauty. Let's talk about what these guys actually do. So I'm going to be very straightforward with what I have done with them. So Janelle used to be my injector for Botox. Now Mindy is my injector. So I do get either Botox or Dysport from either one of these women, and I've really enjoyed the results of that. They do, I would say, what do you call it? Mini Botox?
Just mini Botox.
Mini, because so my eyebrows still move, so you can still see wrinkles, but it's more natural looking, and I've been really, really happy with it. Janelle also did Sculptra on me, which we'll talk about in a little bit. And then I think that's all I've done.
Yeah.
Right. Okay. And then I get facials here too, but that's a different situation. So tell us a little bit about what Botox is, what Dysport is, and what it does for your face, where you use it on your face.
Yes.
I'll shut up now.
So Botox and Dysport, how I describe it to my patients is it has the same active ingredient, but in Dysport, it has a higher percent of the active ingredient. So we use both of them. Sometimes I use on the same patient, some Botox, some Dysport, depending on the area. But our goal with that is to not make people look fake or frozen, because I think that's a lot of people's biggest fear, and also the stigma behind Botox and Dysport.
Mm-hmm.
So Mindy and I work really hard at making patients look natural, meaning nobody looks at them and says, you've had Botox. It's, how do you look good? What are you doing to your skin? What are you doing? You just look great. So that's our goal with those two treatments. We typically stick with treating upper face as well as lower face with Botox and Dysport. But again, each patient is individualized and what they're trying to achieve. So that's kind of Botox and Dysport in a nutshell. Sculptra, we've been really excited about the results we're seeing with Sculptra. Sculptra's actually been on the market since 2003, so it's been around for a long time. And how it works is it stimulates our own collagen. So people, as we age, we lose volume mid-face. We get fine lines and wrinkles. And for some patients, they're not ready to jump into fillers. So Sculptra works by rebuilding our own collagen and helping just make us look natural, make our skin brighter, smooth out fine lines and wrinkles, but not look done.
Yeah, and it's funny because I have so many people. I have patients who tell me, there's such a stigma behind using Botox. There is such a stigma, and I've been at the receiving end of that. I have patients who won't tell their husbands they're doing it, or they won't do it because their husbands won't approve it, or there's so many different things around it. But overall, I personally, as an integrative doctor, have been very happy with the results. And I think it's really nice. And then you guys recently brought in cool sculpting, which Mindy mostly does.
Yes.
Right? So tell us about the cool sculpting.
I have been performing cool sculpting for the last 8 years, so I'm very familiar with it. I've seen a lot of amazing results. It's definitely not a weight loss solution. It's more for people who are active and they have these pockets of fat that they can't get rid of with diet and exercise. So we're able to treat chin, arms, stomach. We can do bra fat, love handles, and inner and outer thighs. So lots of options.
Not butt.
We can do the banana roll.
A banana roll.
So,
What's the
like
banana roll? Oh,
underneath.
Under the butt cheek.
Yeah.
curious about this one. Okay. Banana roll.
So,
Yeah.
Okay. And yes, so it's not someone who's morbidly obese who needs to have massive amount of fat loss. It's for people who are losing weight, but then they have these pockets and based on their genetics and their shape
and the nice thing is there's no downtime. So
at all.
it's like an alternative to liposuction, essentially.
Right.
But you can go on with your daily activities right after.
Right.
I mean, people go play tennis, they go play golf. They do
Like the day of?
Day of.
That's incredible.
Yeah.
Okay. Okay. And then fillers are also very interesting. So we all have walked around and seen people with bad filler jobs.
Yep.
Let's just say that, right? So we've all seen that.
Yep.
So you have to be so careful. And before we joined forces, I actually did training to learn how to do Botox and filler, thinking, oh, I want to start doing this for myself. We'll just bring it into the practice and then we can inject each other kind of thing. And I think it was 4 hours of training that was required. And then I was going to be allowed to put filler in people, which let's talk about that. So what is filler?
Yeah.
It's a big deal.
It's a big deal. And it comes with a lot of risks. Filler is hyaluronic acid, so that's something found in your skin and depletes as you age. But we're injecting it into different depths of the face, sometimes deep on bone, sometimes superficial. And there's a lot of blood vessels that come with risks and complications. So you definitely want to do your research on who you have injecting your filler because complications can definitely occur.
So the face is very vascular, and you're injecting something that if you put that material within a blood vessel, like an artery, you can cause major problems. They're called vascular occlusion, where you lose blood flow to part of your face. You can have necrosis, which means the tissue dies.
Yes.
There's people have lost the tips of their nose. They've lost their lips, requiring major plastic surgery after.
And if you present to the ER with a vascular occlusion, they don't have the medication there to take care of you.
They don't know what to do.
They don't know what to do. So Mindy and I really pride ourselves on safety when we're doing it. And we have all the necessary equipment here that, God forbid, something like that would happen. We can take care of our patients.
And I think the nice thing about all of these things is you kind of like sprinkle them in to a patient's treatment plan. So like, let's say you take a year. I look at how I've done it.
Yeah.
And you have your regular Botox or Dysport injections. If you're doing filler, you do it every how often?
Depending on which filler we use, could be 1 to 2 years.
1 to 2 years.
Yeah.
Sculptra is every 2 years-ish, right?
Yes.
So you can kind of like lay out a master plan for yourself. And, in my mind, I'm just looking, I'm like, I don't want to have plastic surgery on my face, so let's just do as much as we can early on to kind of to keep things going. So naturally, right. Be preventative.
Yes.
And then also talk about spider veins and Kybella and PRP to under the eyes. I don't care which way.
So Mindy is your jam for under eye PRP.
I know.
So she can.
I see everyone getting
that.
It. Yep.
Filler can be very dangerous. Underneath the eyes, there's a lot of vessels there, and we want to be really careful what we put under there. There's also something called the Tyndall effect when you put filler underneath the eyes. The skin is very thin, so you can actually see the filler, and it almost makes you look like you have a black eye.
Yeah.
It's like this blue
hue.
Oh, really?
Yeah.
Okay. Yeah. So
not
everyone is a candidate for under eye filler. So what we offer is PRP underneath the eye. We draw your blood, we pull out the growth factors, and we essentially inject it back in, and you're growing new tissue underneath your eye. So it's very natural. Unfortunately, it's not. It takes time. So it takes about 12 weeks to see results. You do need multiple treatments as well.
How many treatments?
Typically, I say 3, and then we reassess.
Okay.
And then
it takes like 20 minutes?
Yep.
Did you say?
20, 30 minutes.
Yep.
It's very quick. It's probably like 2-3 minutes per eye. So I get in and out. It just feels kind of funny because it's by your eye.
Right.
I've never had anybody say it's painful.
I've sat in the room with her and she's injecting people I know. And we just have a coffee talk.
It's subtle. It's not something that's going to
make you look like you had surgery.
Yes.
No. I mean, I've been to dinner with people who had it earlier that day and you can't even tell.
Yeah.
But it's a really good option if you want something natural to just kind of smooth things out a little bit.
And for the people who have those big bags, right? It helps take care of the dark under eye circles.
Yes.
Yeah.
And it's safe. It's super safe.
Super safe.
That's the important.
Right.
It's you going back into you. So there's no adverse reactions reported from PRP.
Yeah, so it's kind of cool. She draws your blood and then we have this spinning machine. She spins it. It separates out what you need. And then she uses the part of it that she needs to do the right thing, if that makes sense. I'm simplifying it very much.
Yes.
Okay, and then Kybella is?
Kybella is deoxycholic acid, which is a fancy word, but it actually is found in your gallbladder and helps you digest fatty foods.
Interesting.
So some genius person thought if it does that, what does it do when we inject it into fat? It destroys fat cells. So on-label use of it is our fullness, our double chin here, but we have found some great off-label usage of it too, the jawline or the jowls. Sometimes we can get into some bra fat, some small pockets of belly fat, and it works great.
So it's almost like cool sculpting for tiny areas.
Correct, exactly.
Okay. But not using freezing, using a natural fat
to destroy it.
Destroyer.
Yes.
Interesting. Okay.
And you can do cool sculpting and Kybella interchangeably.
Together.
For different
For
reasons.
different reasons?
Yes.
Okay. Okay.
You can start with cool sculpting, kind of debulk, and then
Clean
Janelle
up
can
with
go in
Kybella.
with
Oh,
Kybella.
interesting.
Yeah.
Mhm.
Okay. Okay.
Yeah.
And then I think the only thing we didn't talk about was spider veins. That
Yeah.
one's pretty easy. Do you guys both do spider veins?
Yes.
You do? Okay.
Yeah. I mean, Mindy will do them. I'll
Right,
do them.
right.
It doesn't matter. But we just use a sclera, which is a medication that's been on the market for a very long time. And we just treat very small superficial spider veins. We don't do anything with vascular, like deep varicose veins. We refer those patients to a vascular surgeon. Or if somebody has vascular veins present and spider veins, they need to also see a vascular surgeon.
So you're talking about like those big cordy veins,
Yes.
varicose veins that
Yes.
you see. Those are not something
Correct.
that should be dealt with
Yes.
by anyone other than a
Purple
plastic
ones.
surgeon or a vascular surgeon.
Yes. 100%.
100%.
Yeah.
And I think that's what's also really awesome about you guys is how you have a close relationship with plastic surgery.
Yes, we
So it's a continuum. It's just like I look at it as, my job is to work on the patient from the inside out, their health, their wellness, what supplements are they on, what diseases do they have, can we get rid of the disease, and how can we treat it the best, right? Then you can do like, I don't want to call them superficial treatment because I think that downgrades what you guys
Yes.
do, but you can do more of like the softer
Outside.
treat work.
Yeah.
And then if it gets to the point where it's more advanced, where you might need like tissue removed, like, women who have the big diastasis, or if people who lose a massive amount of weight and have huge skin, tons of skin hanging, that might need to be cut on.
Yes.
Right.
Yes.
So they know when to refer you outside of our building to
Yeah.
someone who can take care of the stuff that we can't take care of within the building. Is there anything I didn't ask you guys that you want to share?
I think one thing we should say that's extremely important is our relationship and collaboration with you
Yes.
as our medical director. I think that's super important that we work in this building with an MD who is very involved in what we're doing, how we're doing things, complications, outcomes, things like that.
Absolutely.
And also working very closely with a plastic surgeon in town where, if there was a major complication or things are out of our control, we have him also that works very closely with us.
Right. And I think we're all of us, probably you and I more than you, just because we've been in the major medical industry.
Yes.
Very well connected with our local healthcare systems.
Yes. Yeah.
So we know who to call if we need to. And I also think that having, leadership and business direction and like, actually everyone here is in it for the right reason. Like everyone just wants people to feel fabulous.
Yes.
And whether that means feeling fabulous because you look good, or whether you feel fabulous because you feel good inside. Obviously you feel fabulous when you glow. Like everyone's in it for that reason, because ultimately when you're in that state, you're able to do the things you're supposed to do.
Right.
And I think we definitely align with that. And like, we just want people to be able to get out there and kick ass at life and like play with your family, be really great at your job, be confident, and be a great part of this world and give back.
And I think that's what separates us from every other small clinic in town.
I would agree.
Doing these things.
Yes, I would agree. Yeah, it's not just a one-stop shop.
Nope.
It's a whole stop shop.
Yes.
And I also really respect that these two are so healthy. They live a healthy, active lifestyle. They're exercising. They're cold plunging. They're constantly working on their health in addition to their business, in addition to their families, busy, you guys have busy family lives. So it's just really amazing and wonderful to work with such a cool group of women. So with that being said, if you guys have any questions or comments, nice ones only, please, feel free to put them in the comments. And I really appreciate you guys taking the time. It was funny. We actually recorded this a couple months ago and I did not have the audio on. So this is round 2, but I think it actually is better. So I appreciate you guys coming back and repeating this. And if you guys want to if you have questions about whether you're a candidate, you do free consultations, right? So you can literally come in and be like, look at me, what would you do?
Yes.
And then they can say, I would do this, 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 and this. And then you can say, you know what, I only want to start with this. Let's just tiptoe into this. Or you can be like, let's just do it all, baby.
Yeah.
So I think, honestly, that's the best way to do it. Anytime you're doing anything, externally, you want to be able to go and get a nice consultation, have them take a look at you and say, you know what, this is what I would recommend. And then you can make your decision from there.
Yeah.
So, and to do that, you call, or the best way to do that is
Probably just book
not
online.
texting you.
Yeah. Just
Don't text Janelle.
booking online at genesisbyjanelle.com. There's a big button that says book now, and you can pick consultation with myself or Mindy, or there's also an office number you could call in which me or Mindy would take care of you that way.
Right. So which is 920-327-7056. You can also, she's on our website as well. So if you go to WagnerIntegrativeHealth.com, you'll be able to find her page on our page as well. So with that being said, great talking to you guys, and I look forward to doing it again soon.